Good morning, Dr. Eric Klaczynski here, Fanwood Back Relief Center. Today we're going to talk about gout, and we're going to give a short summary about gout. Gout is a type of inflammatory arthritis that causes pain and swelling in the joints. Most commonly, it affects the base of the big toe, but it could also affect your ankle, your foot, your hand, your wrist, your elbow, virtually any of the extremities. It's usually a condition that occurs earlier in life and is 3 times more likely in men than women. And this has to do with the increased uric acid in men in their blood. So the body makes uric acid through the breakdown of purines, which are chemicals found in certain types of foods and drinks. We usually excrete purines without any issue through urination, but sometimes when we eat too many foods with too many of that are rich in these purines, the kidneys can't handle the load, and what happens is the uric acid levels in the bloodstream can become very high, and it could form what's called uric acid crystals, which are kind of like these sharp needle-like in shape crystals that basically develop in the joints, and they can irritate the cartilage and soft tissues surrounding those affected joints. Like we talked about before, symptoms can include swelling, redness, burning, aching pain. It can be very intense and very difficult to walk. It could be suddenly just come about, sometimes even just overnight. An attack can last as long as a week if you don't bring down that inflammation down and change what you're eating. So traditional treatment strategies are anti-inflammatory drugs. Both non-steroid and steroid treatments are given to patients with severe gout. But a lot of it can be handled nutritionally, and we're going to talk about some of the ways in which someone can do that. So first of all, staying hydrated is very important. Drinking lots of water can help flush out the uric acid levels in the bloodstream. Other foods to avoid would be foods rich in those purines like alcohol, especially beer, red and organ meat, shellfish, different types of gravies, and sugary drinks. Sugar is the biggest culprit for this. So you want to try to limit the amount of sugar that you have in your diet if you are suffering with gout or known to have bouts of gout. Other things that have been helpful is drinking 100% tart cherry juice, which can help to reduce the inflammation in the bloodstream, drive down those uric acid levels, and help to manage patients that have painful gout. So that's the short summary of gout. If you have any questions about this, if you're looking for any advice or treatment on this, just shoot me a message, give me a call. But these are the things I wanted to highlight in this video. That's all we got for today. We'll talk to you next time. So long.